Hi everyone, we're back to another episode of Health Beyond Borders podcast, and today we have Dr. Vetriana Abd Wahab with us from Alpha IVF and Women Specialist Kota Kinabalu. So today is a very special episode because we are going to discuss something that is beyond the usual IVF treatment that we often hear. So maybe we can have Dr. Anna to explain to us a bit. But before we start, maybe you can tell us a bit about yourself, Doctor.
Okay. I am Dr. Anna Vetriana Abd Wahab. I am based in Kota Kinabalu, Alpha IVF and Women Specialist Kota Kinabalu. So basically, I'm a fertility specialist, but I'm also a pediatric and adolescent gynaecologist. So that I look at women from all from their lifespan, from young to their fertility period, and probably after their fertility period. So yeah, so basically, yeah, that's about what I do.
Yeah. Yeah. So when we talk about IVF, usually it's always like young couples or married couples are now having the intention to conceive. But from your perspective, it goes way before that, right? So what made you, before we go deeper into that, what made you actually specialize into this field? You said that you are in the pediatric and adolescent gynecology because that is such a niche field.
Yeah, it's a very niche field. So, but generally, it is pediatric and adolescent gynecology and fertility. It's under the umbrella of reproductive medicine. So initially, my interest was into young girls with very rare condition, very interesting conditions such as they have like developmental issues, something is not there, something abnormal. And then subsequently, because at the same time I was also trained in IVF, then we can put that into like, oh, actually we have to look at these conditions earlier, because when you see some, maybe not many, that women who presented to us with infertility actually they had an issue that probably can be prevented or can be treated earlier before they come into the picture of trying to conceive.
Okay.
Or probably at the same time as well, like I saw a lot of young girls that they have no more future of getting children or having a family because of their their conditions before that. So these are the main things that push me into this field. So
Okay.
that trying to catch this, like fish in the sea.
Okay, so I think this is an important question for parents, especially. What are some of the typical conditions that you see in young girls that maybe parents often overlook? Like maybe their daughters get like abnormal period pain or delayed puberty. Yeah.
They presented quite a lot of symptoms, but normally some people generally think that period pain is normal in children.
Yeah.
Absenteeism from school is normal because of period pain.
Yeah.
But it is actually not. So basically, if that is one of the cause, so sometimes, right, when we saw girls like this, they probably having a condition we call endometriosis, which normally presented worse in the later age, but actually they developed it earlier, which can be treated or can be controlled so that they won't be having an issue later on in the future. So that is one. Or probably another thing that I want to emphasize is that to give a public more education about screening their young girls from any gynecological problem. such as, which is not very common, but
Yeah.
I do see like maybe 4 to 10 cases per year that young girls having ovarian cysts, big ovarian cysts, because this is not thinkable. No,
Yeah.
nobody think about
Yeah.
it. So, but when girls presented to emergency department many times with abdominal pain and all that, so normal doctors will normally think, oh, this is gastritis and all that, right? But actually, when they presented many times, we see that, oh, they actually have a huge ovarian cyst and things like that. So I think what we can do here is to educate parents, to bring their children, girls, for a screening. Just like a simple scan, maybe once a year or maybe once in 2 years' time, just to make sure that there's no condition like this, so that unnecessary surgery can be avoided,
Yeah.
or we can protect their reproductive organ for future. So things like this.
So basically, the mindset of, oh, she's still young, she'll grow out of it, or that she's still too young to receive health screening, or this is a wrong mindset, basically.
Yeah, we need to change this
Yeah.
mindset so
Yeah.
that the
Especially
screening.
if they have the symptoms.
Yes.
So, just now you mentioned that it is possible for us to get endometriosis at a very young age.
Yes.
Because I think the typical knowledge is that as you grow older, it is possible. I mean, that is one of the possibilities because, because of hormonal changes. But actually, it's possible even when you are still young, but is it before or after puberty?
Actually, you are right, because most of the cases, by the recent studies, right, endometriosis was actually, we noticed that the symptoms was actually happen years before the diagnosis. So, and we only diagnose endometriosis later on, whereby it probably could happen way before that, because endometriosis not just presented in one symptom. Some of the patient has no symptoms at all. Some they have pain, some have fertility issues, some have both pain and fertility issues. But there are some patient who has no symptom at all until the later stage, that it's very bad already, something like that.
So that's where the health screening is important.
Yes, health screening is very important.
So in a way, you should treat it like a dental checkup, right? If that makes sense, because you said just now, like once a
Yes.
year, maybe it's safe for you to just for your peace of mind, and maybe it can save you from something even more serious.
Yeah,
like,
in my practice now, yes, especially when I see girls with the gynecological problems, right? I always tell the mother or the parents, oh, please tell your other family members, go and do a screening, because we never know. Because when they come, it's like sometimes it's too late, or we need to do more bigger surgery than it should, whereby we can probably get away without no surgery at all.
So you also mentioned about ovarian cysts just now among young girls.
Yeah.
So is that purely genetic, or have you seen like a rise in cases maybe due to our change in lifestyle, like our food intake, the processed food? Or
It's very difficult for me to say that, because I don't know what they eat, what people eat nowadays.
Yeah.
But some of the patient, yes, they presented with like ovarian cysts, and all these conditions are normally random. We don't know what's the cause. Because if we know the cause, we can prevent it.
Yeah.
So some of them presented as ovarian cyst itself, but some they presented with, we call it paratubal cyst. So basically it's outside the ovary. But it may damage their fallopian tubes. Something like that. So that's why screening is very important.
So just now off air, we were talking about ovarian tissue cryopreservation. Yeah, maybe you can tell us a bit about this process?
Ovarian tissue cryopreservation, in short form, we call it OTC. So this is a medical techniques whereby we harvest the ovarian tissue from the girl from a very small surgery, and after that we will keep the ovarian tissue in a very low temperature, meaning we freeze it, and then probably we can use it later in the future. So these are commonly done in an advanced medical country to the patient where they have normally in a patient with early cancers, young cancers, or probably genetic condition that may disturb their hormones later on. So, for instance, for example, like a young girl who are diagnosed with leukemia. So, before we start the treatment of chemotherapy and all that, so we do this procedure first to save the ovarian tissue and keep it away, and then they can go for their normal chemotherapy and all that. Then when they are better in the future, and then we can put it back. So why we do this? Because nowadays the advancement in medical treatment, especially in cancer treatments, it is very good. So patient mostly can survive. More than 80%, 90% can survive. However, if we don't do this, this treatment can damage their ovarian tissue. So when they damage the ovarian tissue, then they will go into early menopause, or probably they don't even develop their puberty, and we have to help them to induce their puberty after that.
So this is a very interesting topic, because usually when we talk about fertility, or maybe when people hear, alpha IVF, right? Maybe they think about freezing the sperm, the ovum, the embryo, but this is preserving the ovarian tissue, which you don't even need to reach puberty before.
Correct.
So how early can
so
you?
basically, this we do it in especially to the young girls who has not developed puberty yet, because they have not developed the eggs that we can stimulate like in IVF, but we take the tissue first, and then we keep the tissue. So later on we can use. And actually now with the recent data, they are also talking about in the future probably that this tissue can actually extend the hormonal help for the ladies, then to delay menopause and things like that. Yes,
okay.
They've been talking about it.
Oh, so there's a possibility maybe you don't plan to have kids now, and then you want you want to try a 40. Maybe this is possible in the 40, 50.
So now they talk about, for those who wanted to delay their menopause and all that, or probably they wanted to extend their internal hormones and all that, right? So what they do at 30, 35 years old, they harvest their ovarian tissue, keep it away. So later on at 45, 48, when they develop the symptoms of menopause, then they just put it back in the body, all right? And then to extend their hormonal supply. Yeah. This has been done actually.
Okay, so I think.
But we have not done that in Malaysia.
Okay, not in Malaysia.
Yeah.
But the OTC itself is actually available in Alpha IVF, right?
Yes, we can. We are providing it. If we have a patient, then yes, we can do it.
Okay, so I think it is safe to say that fertility doesn't start when you decide you want to have a baby. It should have started
it should
at
be
a very young age.
It should be planned, and it should be an option.
Yes.
And so.
Okay, so I think that is a very interesting start to the podcast. So we'll take a break now, and we will continue after this.
Okay.
Hi guys, welcome back. We are now with Dr. Ana Vetriana, and we've been talking about just now OTC or ovarian tissue cryopreservation. Okay, so this is basically for young girls, pre-puberty. So fertility is not just about sperm, ovum, embryo freezing, but also for this very particular ovarian tissue preservation. So maybe some of our audience are wondering about how about boys or male in terms of the fertility, what kind of preservation can we help?
So for boys, normally for boys generally they are producing sperms almost every day until the day they die.
Okay.
So their sperm is not going to be depleted, but yes, the quality may reduce, the number may reduce, but they will still have it. Okay, but in certain conditions whereby they have cancers and things like that, and they are going to go through a treatment such as chemotherapy or radiotherapy. So especially those who are affecting the gonads basically their eggs, right? So the one thing that is important is that they can do a sperm freezing. So even with the sperm freezing, they can use it for future. So, and yeah, that is one of the options that can be done.
For this is just at the top of my head right now. For young men, is there something an equivalent disease to endometriosis that is serious for that can affect them?
It's very rare. No, I don't think so. Except that if they have like, like probably they have a torsion of the testes before. So sometimes when the testes or scrotum got injured before, so probably the production of the sperm from that part is actually reduced. But other than that, they don't have like a chronic conditions like in female, like endometriosis, like PCOS, like that.
Okay.
Yeah, but they do have a certain condition, like hormonal condition that may affect the production of the sperm. They probably have a genetic problems that cause them not to have any sperms and things like that. But these are generally sometimes we can detect it earlier, but sometimes we detect it during the fertility screening.
I see. So just now you mentioned that for men, basically they have the eggs or the sperm. They produce it until they die. But I think the common misconception for women is, I mean, it's not the same, right? Because maybe we think, oh, okay, I can still try until I reach my menopause stage. But is that true, or are we actually already born with a certain set of eggs?
Yeah, for female it's different. For female, we are born at a certain number of eggs. So the day that you were born, you are already have a certain number of eggs, and that are the numbers that you bring forward. So basically it will get reduced day by day, year by year, and we don't know when it's going to be depleted. So basically our cut-off age is 35 years old, whereby the quality and the quantity is going to be very, 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 very low at that point of time. However, these conditions can affect women earlier if they have certain conditions such as endometriosis, or if they have a genetic issue, or the lifestyle. So, or probably if they have surgery before, ovarian surgery before. So these are we call reserve, ovarian reserve, meaning how many storage of eggs that you have left. So that's why we advise for ladies, women who are married, if they are more than 35 years old, don't wait until 1 year to seek fertility treatment if they didn't conceive yet. So maybe come earlier, 3 months to 6 months after that. So but younger women, younger couple, they can wait for about a year. But if you have a condition such as endometriosis, PCOS, or you have a previous surgery before, you know that you have a gynae issue before. So after you get married, you are trying to get pregnant. If you can't get pregnant by 3 months, 6 months, seek an advice, seek treatment.
So okay, when you say that we don't know when the eggs are gonna deplete, so
Yeah.
so it doesn't work like, okay, every time every period cycle I will give out one egg. It doesn't work like that.
It doesn't work that way because sometimes the number of eggs, we don't know how much number of eggs is depleted per cycle. So we at this moment, at this juncture, there's no research to say that this month how much eggs I used.
Yeah.
No. But we know that there are certain pool of eggs that coming out in each cycle, but only one eggs got mature in that cycle. So that's what we use for ovulation.
So there's no way for women to like add or reduce because when you are
there's-
born, that is the only
there's a
number
way to like somehow gauge where is your baseline is by doing a test. We call it anti-Mullerian hormone,
Oh, okay.
AMH. This is a blood test that we can take at any time
Okay.
to look at where we stand.
Like, I do-
Are we at the normal level,
Yeah.
or we are like in
So,
the
like, how
in the like
many-
or we are still okay, or we are not okay. So something like that. Yes, we
okay.
do have, but this is not just show that how much eggs you have. It just that gauge that you are how much eggs you have reserved, something like that.
Okay, so when you mentioned like we some of the common struggles like endometriosis, PCOS. So let's say you get a patient in her 30s, maybe like 35 years old, coming to you, okay, I have endometriosis or PCOS. What would your advice be, or what would the treatment be like?
So it's two different. When you talk about endometriosis and PCOS, it is two different entity, and they are both affect fertility in a different way. So endometriosis probably is the quality and the number is depleted, but in PCOS it's more about maturity. So let's say I have a patient at 30 years old, single, with endometriosis. Then at that point of time, we will tackle what is the issue. Is she presented with pain, or is she presented with just a cyst and things like that? If the cyst is not too big and the pain is the only issue, then what we do is that we can give them hormonal treatment. No need to go for surgery, because if we do a surgery for endometriosis, we always aim to do only one time surgery, and the best surgery to reduce the symptoms, because every time we do a surgery, then we are going to remove the eggs away. So that's why we try not to do that. So we try to preserve as much eggs as possible, because we also know that in a woman with endometriosis, it's not just the number of eggs is low, the quality probably is not very good compared to the general population. So, and for this kind of condition, normally we will ask what are their future planning. When are they planning to get married? How many children probably she wants, and all that. So if, like, let's say she thinks that she wanted to have a family in the future, but probably she has not find the right person, the right partner.
Yeah.
So yeah, maybe egg freezing is one of the choice. Or probably if she's already got married at that point of time and have been trying for 3 months, then she should be, a candidate for the fertility treatment.
So when you say egg freezing, meaning I'm trying to imagine the process. So is it a minimally invasive surgery for you to get the eggs?
Okay, egg freezing basically it's like a part of the IVF, but without the fertilization of the eggs.
Oh, okay.
So basically, what we do, we normally give an injection at the tummy for about maybe 10 to 12 days to accumulate and the eggs, and with the number of eggs. We try to get as much eggs as possible. So when it matures, then we will do a procedure we call oocyte pickup or ovum pickup, OPU. So this is the only procedure that needs to be done under minor surgery. So basically, we will put the women to sleep under sedation. All right, and then after that, we will harvest the eggs using a small needle to harvest the eggs. And after that, then we process the eggs and we freeze the eggs until she wanted to use it in the future.
So basically, you do get patients who maybe they already have like a whole life plan ahead of them. They want to do, maybe they want to focus on their career first, or maybe
Yes.
their studies. So they come because they know of, the possibility of
Yeah.
the quality maybe in the future. So they
Correct.
come to you and do the egg freezing first.
Yes, so this is where the public education is
Yeah.
play a very important role. So for instance, I have a patient. She is 36 years old. She actually got engaged, but
Okay.
but she has to go to UK to further her PhD for another 4 years. So she's 36, right? So another 4 years, then she will be like
40.
maybe 40.
Yeah.
But she already engaged, but she said no, not yet. Not gonna get married first.
Yeah.
So she come to us. She did the egg freezing. Yeah, and because she thought that probably I wanted to use it in the future, something like that.
So maybe some are thinking, how long can I actually keep my sperm or my eggs in the bank?
We always say forever. You can use it forever, but you have to look at the reality.
Yeah.
Because when you do the freezing, probably at 35, 36 years old, but you want to get pregnant at how old? I don't think you want to get pregnant at 50 years old, 55 years old, right?
Yeah.
So probably up to 44, 42 years old, you can still keep it as long as we keep it in the we call it liquid nitrogen. But we always say fridge. So yeah, it's okay.
A special fridge.
A special fridge, yeah. A special, not like a normal fridge, yeah.
Okay. So basically, technically you can keep it forever.
Technically, we can keep it forever.
The technology allows you
So basically, if you do an egg freezing at probably 15 years old, you can keep it forever until 40 years
Like-
old, 45 years old, something like that.
like just now we were talking about OTC, so you can keep let's say you take the ovarian tissue from a 9-year-old, so you can actually
Keep
keep
it,
it until
yes.
like she's 20,
40? Yeah.
30.
Yeah. Correct.
Okay, and I think off air just now, I'm sorry, I jumped back to the OTC. We were talking about how when you put it back, you can actually get pregnant
Spontaneously. Yeah.
like-
We can, if we put it back to the ovary, ovarian, to the normal place, we put it back to the ovary, yes, they can get pregnant naturally.
meaning they don't even have to go through IVF.
Probably they don't have to go through IVF.
Even though they were like cancer survivors.
Yes,
Or, yeah,
correct, yeah.
Okay. So, okay. Now, I think we want to move forward to talking about how Alpha IVF actually receive international patients. But I think we'll get to that in the next segment.
Okay.
Hi everyone, we're back to the final segment of our podcast today. So just now we stopped at wanting to talk about how Alpha IVF actually receive international patients. So doctor, usually whenever you receive these international patients, how do they, come about to know about Alpha IVF or the treatments that you provide?
There are many ways, but one of the ways that from colleagues, because for other than IVF that it's easy, everybody they know Alpha IVF, but for a niche issue like for PAG cases, so normally the referral came from colleagues from other hospitals, other states. And also from the satellite clinics of Alpha IVF that we have all over Asia.
Oh, okay. So when you say satellite clinics, they're not physical clinics, or they are?
There are physical clinics. There are few in Indonesia, and then also, if I'm not mistaken, there are also few centers probably in China, but I'm not very sure about that because I
Okay.
have not received any patients from there. But from Indonesia, yes, we do have satellite clinics, and also from other friends, colleagues from other hospitals as well, because there are not many pediatric and adolescent gynecologists in Malaysia, or maybe even in Asia, not many.
So, PAG is pediatrics and
Adolescent
adolescent
gynecologists, yeah.
gynecology. So, not only for IVF, but you do receive patients, or those who are interested for PAG. Okay. So, usually from which countries do you receive these
So
patients?
far, it's from, of course, from Malaysia itself, from Indonesia, and also from Brunei.
So basically, not just young couples or married couples. You also receive so-called children, lah, right?
Yes,
Yeah.
as well as also patient with other gynecological condition that probably deter them from having children, like probably fibroids and things like that as well.
If I may ask, what would be what was your most recent treatment by an international patient, like the most recent treatment that you did on an international
The
patient?
most recent one was a patient from Surabaya who were referred from another hospital actually, from Penang, with blockage of the vagina. So this is a young girl, about 9 years old, who presented with abdominal pain for months, right? And then when they seek sought treatment in Penang, then they found that she had, we call it a transverse vaginal septum, whereby it's actually blocking the menstrual blood to come out.
Oh.
So her uterus, her womb was actually very distended, very, very big, full with blood. And then she was referred and came to KK, Kota Kinabalu, and I did a surgery for her to create the channel. Yeah.
Would that be a minimally invasive surgery, or?
Yes, minimally invasive.
Okay.
So what I did is that I did a keyhole surgery for her, and then also open up the septum from the vagina to create a channel.
And that can be done through a keyhole surgery. Keyhole
Yeah,
is like
we do a keyhole surgery
okay.
that to assist, and then we open up also from below, from the vagina itself,
Okay.
to create the vagina for her. Yeah.
So basically, the uterus has a septum. Septum is
Yeah.
like the nose. This one,
A
right?
septum
so
is like a, you know,
instead
like
of one.
instead like a, you know, like normally in a uterus, right? So
Yeah.
you have blood, menstrual blood flow, and then it will come up from the vagina,
Yeah.
right? So what happens is that there's like a wall, like a transverse wall like that. So it's like blocking blocking the flow. So we have to open up this part.
So okay. Now I'm interested to know if you have any. I'm sure you have a lot, but what would be your most unforgettable patient journey, or what would be the rarest condition that you've treated so far?
Rarest condition. Actually, my interest is actually looking at rare conditions. But now, to think about it now, I think about two sisters who presented. Actually, one of the girl presented first to me with severe pain every month, like period pain. She has a pain. She has a period, but very, very severe pain every month, like, and then absenteeism, can't go to school, And then always go to see general practitioner, taking painkiller injections and all that. So what happened was, then she was referred to me. I saw her when she was probably around 13 or 14 years old, probably around that time. Then I found out that she actually has two uterus. She has two uterus, but one of the uterus is blocked. So this condition we call OVIRA, OHVIRA. A quite rare condition whereby the girl has two uterus, two vagina, but one of it is blocked. And at the same time also she has only one kidney. All right, so
two uterus,
two vagina, but
one
only one kidney. Yeah, so she has one blocked uterus. So I open up the blockage, remove the blockage and all that, and because of these conditions, right, that has been long enough, she developed endometriosis as well. So I've been seeing her and all that, but later on, probably, I'm not so sure, maybe around the same year, her sister came to see me, and then her sister presented with heavy menstrual bleeding, like heavy until needs blood transfusion and all that.
A younger sister, an older sister.
Well, let me see whether, I think it's a younger sister. And then we manage her with hormones, with other medications and all that. But she's still having an issue with bleeding heavily. And after we do some screening, and then we found out that this girl has a condition whereby there's a deficiency of a certain substance that causes that the blood is very, very light. So basically, it's very difficult to clot. All right. So because of that, we have to screen the whole family. And then they found out, and then we referred to hematologists and all that, and we know that in the family there are a few of them that having the same problem as well. But yeah, something like that. But looking at that, right, now we manage them properly and all that, and the two girls are one now. The elder sister is already working now, I think, as a landscape engineer, if I'm not mistaken, and the other girl is, I think, maybe finishing university. And they are very well. So
this was
I'm
many
very
years
happy.
ago.
This was many years ago.
But we already had that technology to treat them, to assist them with their problem.
So I'm very happy for them. So one of the rare condition.
So the rare condition you mentioned just now is OVIRA, which means you have two uterus.
Two uterus,
so it's
one
possible,
block.
It's possible to have two uterus.
Yes.
At most, how many uterus can you have in the body?
So far, two.
Two.
We do have conditions whereby they have other uteruses but not functioning. And there are also conditions whereby a woman has no uterus at all.
When you say no uterus, because I'm not good with the whole, but when you say no uterus, does that mean you do have like all the fallopian tube, but no uterus?
It's maybe part of it. So we call them as a MRKH syndrome. Actually, we have it's quite, I think 1 in 5,000 women has this. And even in Malaysia, we have a support group for that. So their conditions sometimes not similar to each other, but part of the reproductive tract is not formed. So sometimes they don't have the upper part of the uterus. Sometimes they don't have the vagina. Sometimes they don't have the hole. So we have to assist and create the hole and things like that for them.
So even though you do not have a complete or you don't have a uterus, it is still possible to be treated in terms of.
Well, if they don't have uterus, so basically the chance of them to have children in the future is almost zero. But yes, there are technology coming, such as uterine transplantation and all that. But we have not done it in Malaysia. It has been done in Japan, in Saudi, and in Sweden and all that. So, but it has not reached Malaysia yet. But yes, in the future, we're still looking forward.
So just now you mentioned MRKH,
MRKH.
which stands for?
Well, it's Meyer-Rokitansky
Okay.
Kushner-Hauser syndrome. So
What does that
basically,
mean?
yeah, so that's why we call it just MRKH
Uh,
syndrome. If you Google MRKH, then it will come out.
okay.
So it's a condition. Then part of the reproductive system is not present, not like a normal women. So yeah, we do have a condition like that.
So I'm still like thinking about the whole, uh, meaning when you don't have the uterus, does that mean that they don't get periods
Yeah, they
or?
don't get period. They don't
Okay.
get period, but there are certain women when if they only have a bit, there are many types of it, but most of them they don't have period. So they don't have period, and sometimes they don't have their vagina is not well formed. So how we assist these women is that we create the vagina for their lifestyle. I mean, for their sex and all that, intimacy with the husband and all that. But in this kind of condition, normally we have to counsel. If we see them earlier, then we will counsel
Yeah.
them way early,
Yeah.
even before they get their boyfriend, before they get
Yeah.
married and all that, so that they understand their situation.
Yeah.
So these girls normally presented with no period at all. So when they are 15, still no period. 16, still no period. And then when we assess, so
But
we
maybe
yeah.
initially they don't have any idea why, right? Why they
Yeah.
don't have.
So the idea is that
maybe
the
like
mother is
late.
thinking, why you still have no period, something like that. So when they come, and then when we investigate, we assess, then we found this condition. So this is where we treat them, or we manage them. So not only by medical surgery or whatever, but it's also by giving them support, counseling, get them to get support from the public, from the same population who has this problem, so they
Yeah.
can have their support group. Yeah.
More awareness on
More KH,
MRKH.
yes.
Okay. So just now when you were talking about ovira to uterus,
Yes, yeah.
right? So can somebody actually get pregnant at the same time for both uterus, or does that happen?
It happens, but very rare, because it's also works as like a twin and things like that. But generally, they only pregnant at one side at each time.
Okay.
Yes, back to this. I also have a patient who also presented with pain and things like that earlier. Then we found that she has an ovira with a block part. So after removing the blockage, then she get pregnant after that. So she got pregnant on the block part first, and
Oh,
then okay, I deliver her. Then 2 years after that, she get pregnant with at the other side, and then actually she came 3 times to me
Okay.
for delivery, and she delivered on the other side. So this thing, I always play with her. I tease her like, actually, yeah, you can get pregnant many many times because you have a lot
Yeah.
of uterus. Because sometimes when in a general gynecologist, right, if you have cesarean section, you can
Yeah.
only go for 3 times delivery,
Yeah.
right? But because since she got 2 uteruses, she can actually go for 6 times. But she said, no, enough of 3. Yeah.
That's why actually when we were off air, I asked you if it was natural birth or
It was
Caesar. So
they can go for
yeah.
normal delivery, but most of them go for cesarean section.
But because it's two uterus, so the recovery is. I mean, you can go to the next uterus, right? So you don't have to wait for, in a sense.
Yes, but family planning is very important.
Yeah, of course. Okay, and then I suddenly remembered when I interviewed Alpha IVF in KL, they have a bell, right?
A bell, yes.
Do you guys have a bell in
Yes,
Kota
all the
Kinabalu as
center
well?
for IVF we have a bell.
Oh.
So this bell is like a bell of joy, we call it. So when a couple get pregnant after their IVF treatment, then they will ring the bell.
Yeah.
Yeah. So
it's
actually, at the same time, to give support to the other
Yeah.
couples as well, and to give them more, spirit. Yeah. So they can, so that they can go through, because fertility and IVF journey is not it's not an easy journey. Not
Yeah.
everyone will have an easy journey.
Yeah. So I think we're running out of time, but I just want to hold you a bit more. Maybe you can run us through how, if somebody from outside of Malaysia is interested to seek your treatment, to go to Alpha IVF Kota Kinabalu, what would be the first step?
I think they can contact our center, that which is they can easily get us from in Instagram, TikTok, from the website. And once they give us some information, first of all, they don't have to fly all the way. We can always do a virtual consultation first to get their, sometimes they can give their reports first and all that. Then I can go through that, and then we can do a virtual consultation. This is what we normally do for our Indonesia, Brunei patient, China patient. Then after that, they can come for a further checkup and all that.
Okay. So I think we are nearing the end of our
Okay,
session.
all right.
Do you have any last words you would like to say?
Last word. Okay. So I think fertility journey shouldn't start after you get married,
Yeah.
but it should be planned way earlier, because if you know your condition, you have a lot more options, and probably we can avoid unnecessary medical treatment.
Yes.
Yeah.
Okay, thank you so much, Dr. Anna. Thank you
Thank
so
you.
much
Thank you
for
for
being
having
with
me.
us today. Thank you. So I guess that's the end of our episode, and we'll see you in the next one. Bye-bye.
Bye-bye.